Hello, it's Midwife Christine with the Birth Exchange podcast. I am here with my favorite chiropractor, Dr. Twila Blossom.
Whoop, 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 whoop.
Representing the east side of Atlanta, honey. Where are you at? Stone Mountain.
Snellville.
That's why I don't see you, because you
Well, east side is best side.
That's a lie. Who said that?
I did.
Okay.
No, I'm in Snellville, servicing Gwinnett County, Grayson, Loganville, Tucker, Decatur, Lithonia, Conyers. Y'all come see me.
Okay. First, we got to know about you, because we don't know what you do, like, for real, for real.
I'm a chiropractor.
So the people need to know what that means. So what is a chiropractor?
So a lot of times people think chiropractors are the people who help you get out of pain. And that's true. But what I want people to understand is that pain is just your body's way of letting you know that something is wrong. And pain is not a true expression of health, but it's just to say, hey, something in your spine and your muscles is out of alignment. And so as chiropractors, what we do is we look at your entire spine, see what bones are out of place using x-ray, a posture analysis, and we adjust the spine accordingly so that your nervous system can function and you can definitely get out of pain. That's cool. You looking at me like, what does that mean?
So some people might think you only see a chiropractor when you're in a car accident or some injury at work.
Right.
So is chiropractic care part of wellness care?
It's absolutely part of wellness care because how can I make this very simple for the listeners and the people? Because so let me pull up my prop.
Please.
So as you see here, this is a model of a fully developed spine. This is the front of the spine, and it runs right down the center of your body. This is the side view. These finger-like projections are where the nerves exit the body, and then this is the back of the spine. Your spine, like I said earlier, is a house for your nervous system. So your brain sits here, and it's always sending signals down through your spinal cord, which runs the length of your spine. And off that spinal cord, you have nerves. Now, these nerves are going to touch every muscle, cell, and tissue and organ in your body. But when we go through different things like slips and falls, car accidents, having kids, because
that part, we'll get to that part.
You're going to get to that part. It can cause bones anywhere along your spine to shift out of place. And when these bones shift out of place, they end up hitting the nerve. And this shift is called a misalignment, or we call it a subluxation. And when that bone sits on that nerve for too long, it's not sending a good message or signal to that assigned muscle or organ. So when I adjust you, I'm looking at the x-rays as a guide to determine what bones are out of place. And we begin to retrain the spine to go back where it should go, so that the signals coming from your brain going down your spinal cord into your nerves can flow without any type of interference.
So this realignment is not going to happen in 1 or 2 visits?
No, the realignment can happen in 1 or 2 visits, but what we're doing is retraining the body where it should go. So I tell people, so imagine this. Imagine if somebody wanted to lose 20 pounds. How many times they need to go to the gym?
A lot.
Right. So can they go one time and say, oh, I lost my 20 pounds?
No.
Why?
Because it don't work that way.
Right. The same thing with the spine. The spine has a certain muscle memory, and so when you get adjusted on a routine and frequent basis, it allows the spine to go back into where it's supposed to be.
Interesting.
Very.
Now, what does scoliosis look like? Because I have that.
Scoliosis just means it's a curvature in the spine. So it could mean something like the spine could be shifted this way. And so scoliosis can be, it's 2 types, main 2 types of scoliosis. It can be either one that's we call functional or structural. So functional could be, hey, I had a situation, I fell, I had an accident, my spine got out of alignment, I never got it checked out. Structural could be, I was born that way. So most of the time, you can still, even as an adult who in their 30s, we can realign that spine to get more straight and more aligned. It just takes consistent and routine care.
So what happens during pregnancy?
Oh, kids jack up your spine.
Because let me tell you.
They jack up your spine. They take your spine all kind of ways.
So 100% of our moms who have chiropractic care during pregnancy feel much better.
Right.
and they're surprised that they don't have all the aches and pains and the ailments that other moms may have. And
Okay.
they are literally waiting to feel something, right?
What you mean by they're waiting to
They're
feel something?
they're looking or expecting to feel bad. They're expecting
Okay.
to feel, because that's all they hear.
Oh, because
girl,
you're going to have low back pain. You're going to have numbness and
Right.
tingling. You're going to have sciatica.
Exactly.
Okay. So
So is it safe, first of all, to have chiropractic care during pregnancy?
Yeah, I see pregnant ladies all the time in my office. And so I've seen ladies who've been in the middle of labor getting adjusted, and it actually helped they actually
I'm sorry. That was interesting to me. I didn't mean to throw you off. I'm sorry.
Okay. She looked surprised. So I was like, wow. Okay.
Mhm.
So, yes, so I had a lady.
It's safe.
It's safe for women to get adjusted while they're pregnant.
Mm-hmm.
I'll tell you a story. I had a lady who was actually, she had been in labor, I think 2 or 3 days.
Mm.
And so her midwife sent her to me because she was like, she needs to get adjusted because the baby, her labor was not progressing like it should. So I remember her being on my table, and she got adjusted, and the baby was born later within a couple hours. And so this is what happens when a woman is pregnant, and as the baby is growing, the baby begins to, because this is the pelvis, the baby begins to grow here. And what happens is the spine starts to do this.
Mm-hmm.
So as the spine does this, or makes this shape because of the weight of the baby, that puts pressure on those nerves. So now those nerves can't send good messages to that low back or even the uterus or in the pelvis area to help with that expansion as the pelvis expands, to make sure the baby can't stay head down. Especially during like halfway through pregnancy, I guess you would say, 20 weeks?
Mm-hmm.
That's when does the waddle start? When the mom starts?
Probably third trimester.
Okay, so about 28 weeks. But that's when the baby is pretty large and it's causing the mom's back to do this. Because of the weight of the baby. And she's very uncomfortable, and the organs have shifted, and the lungs are getting compressed because the uterus has expanded. And so she's very uncomfortable. And so what chiropractic care can do is just help send better messages to the mom's nervous system that's actually aiding in the development of the baby too. And giving the mom some relief and keeping the pelvis open so the baby doesn't breach.
So is it true that if women go to the chiropractor pregnant, like, do you crack people's backs and all that stuff?
So I don't crack backs. I adjust spines.
Because that's a fear that a lot of women are like, I'm not going to chiropractor. I don't want them cracking my back. And
so that sound that we hear is it's just air that gets released from your joint space as you align the spine. That's all that is. It's very similar when people crack their knuckles.
Yeah.
That's it. But what's happening is when you keep your spine aligned, your nervous system can function at a high level, which does what? It helps make sure that the baby is developing properly and that the mom feels great.
So does chiropractic care, can it help decrease your risk for a cesarean?
I don't want to say.
Is there any research around that?
It is some research around it, but that's what we tell people. I don't spin babies or move babies. I make sure the mother's pelvis is expanding properly as the baby develops so that the baby can stay head down in the right position. So I do believe, just based on my experience and professional opinion, that it can reduce the amount of C-sections that a woman has.
Mm-hmm. Interesting.
Very.
So should moms go after pregnancy?
They should go after pregnancy.
And when?
When they feel that they are ready to come out the house, because I know that's some different cultural beliefs with that.
I know so the next day I'm going, right?
Some people come the very next day, and I'm looking at them sideways like, girl, you need to wait a second. But, as soon as they feel better and they're ready to come out the house, I totally recommend it.
So we have a viral clip of you.
Oh, God. Oh, you talking about
adjusting.
When I adjusted TJ.
Let's see if he can turn his head. Bless you. Bless you. Wait, hold on. Yeah, I know you. Okay, let's check his hips. He not gonna like this tummy time. I know. I know. You're not gonna like this part. Let's see. I know. I know. Okay. I know. I know. You're not gonna like that part. Okay, I'm almost done. Yeah, I'm almost done. Okay. Yeah. Okay, that was it. You did good.
Oh, I think he liked it.
I'm next.
That you
Adjusting
took.
your
Yeah.
newborn baby.
Yes.
He was fresh out the womb.
Fresh
Maybe
out.
an hour or so.
I don't even know if it was that long.
I don't think.
I remember that clip.
The people loved
The
it.
people loved it. Yes.
So explain
All his
chiropractic
goodness was
care
out.
in
Infants.
newborns and infants.
Okay, so
Because that's really interesting, and a lot of people don't know that you can take your baby, and there are different conditions too in which you would take your baby to the chiropractor.
okay, so I don't know if can y'all get a shot of this pelvis? You see it? Okay, I'm sort of kind of doing your job, so you got to help me if I'm wrong with how the baby comes out.
Okay, it's just coming out of one way. So
Okay, so as the baby's head, I wish we had. You don't have a baby.
I don't.
Okay, so as the baby head is coming through the pelvis here, the baby's head is turning and twisting. So if the baby's head is turning and twisting, that means their spine is turning and twisting. And so what happens is, remember I said earlier that the spine is a house for the nervous system. So at a very young age, just through the birth process alone, the baby is already having misalignments. So what can that lead to? Ear infections, colic, restlessness, torticollis, shoulder dystocia.
Mm-hmm.
So getting the baby adjusted as soon as they are out of the womb, it makes sure that their nervous system is functioning well. And it does help reduce ear infections and things like that.
So that's interesting. I'm glad you said shoulder dystocia because if moms have difficult births, going to the chiropractor is probably taking your baby to the chiropractor is probably a good idea for recovery from the birth.
Right, for the mom and
for
the
mom
baby.
and baby.
Right.
I like it. And so sometimes babies have issues with lactation.
Right. So TJ had an issue with lactation. He was tearing my nipples.
I remember.
I called you like, this is ridiculous.
Take the baby back.
No, don't take
him with you.
Yeah, because this, and he likes to eat. So this is a problem. But I had to feed him. Mm-hmm. So we had to get through it. And so I forget the lady who you referred, Kiana.
Mm-hmm.
Oh, sorry, Kiana. I got your name wrong. But Kiana really helped me through that. But what we found was that his jaws and the muscles all through here were tight from the birth. So I did a lot of work with him manually with adjusting some of the bones in his neck and even doing stretches through his neck and shoulder area to help release everything in his jaw. Mm-hmm. So we did that for about 2 weeks and we saw a difference with his how he latched, and he was not tearing my nipples up because he was having a good old time doing that.
Yes.
So that helped.
Lovely.
Yeah.
So tell us about your practice.
What you want to know?
So you're in Snellville.
Yeah.
And you're a wife-husband duo. Like you all have
like Kelvin.
Like Kevin. Oh, like he's my mid-husband. So
Travis is he's part owner of the practice. We are part of 100% Chiropractic. It's a franchise. He and I own that particular franchise. He actually is, to me, the main boss.
Really?
Yeah,
Nice.
He keep me in line. Because all I want to do is adjust, take care of the patients. Then he reminds me we got to run a business.
That part.
Yeah.
They're good for that, husband.
Yeah, they're good. He's a great guy, and I appreciate him being in the practice.
Yes.
But we mainly see wellness patients
Mhm.
because I'm real big on, honestly, changing the culture of healthcare and letting people know that when your spine is in the right place, your nervous system can function well, and we can start to get over some of these health disparities that we've been seeing. And because we have people who come to our office who have gotten off of diabetes medication, who have gotten off of antidepressants, moms whose babies were breech and the babies turned, and they had successful births and didn't have to have any type of surgical interventions. We had people who had migraines and 3 or 4 times a week, and now they're down to no migraines. So we really, in that office, we really love on our patients. We treat everybody like family because I believe that if you come to a place and the environment is fun and uplifting and inviting, then people will heal. People don't heal in places where it's toxic. And they're not getting the truth, and they're not getting excellent care. So chiropractic is the main, I guess, treatment there, for lack of a better word, but we also offer massage therapy, laser therapy, and stretch therapy as well, because you do have muscles that attach to your body, and sometimes you need to relax, and sometimes you have some things going on that you need a lot of muscle, what we call muscle work or soft tissue work.
So I'm not having a baby, but midwives, okay, like myself.
Yeah, y'all need some
We
work.
are twisted and turned and contorted all throughout the labor and the birth. We need to go to the chiropractor.
Absolutely.
My chiropractor in Fayetteville,
Dr. Asia.
I ran into her the other day, but I was like this.
Don't be
because
shy.
I'm so non-compliant. I just don't take my butt in there like I'm supposed to.
Why not?
But when I go, I feel great.
Well, you gotta go.
I know. So midwives, go to the chiropractor so y'all can, have a few more years in this work.
Because y'all do a lot of great things.
Yes.
Y'all bodies.
But our bodies are
you got to take care of your
misaligned.
Bodies. You got to take care of your body so that you can get these babies here. We need you.
Well, we need you. So let me sit up because you probably judging my
I ain't judging
my posture and whatnot.
I am not judging you.
Can we talk about home birth?
Let's talk about it.
Tell us about your experience, as much as you want or as little as you want.
Okay, so you delivered 2 of my babies. The first one was in the hospital. The last one was at home.
Yes.
TJ. Okay. I decided to do a home birth primarily because I wanted to make sure can we be very candid here?
Please do.
I wanted to survive. I didn't want to die in the hospital. And my first experience with you when you delivered my daughter Taylor was I dealt really only with you in the clinic when I came for my checkups. You helped deliver Taylor. I didn't even see the doctor. So when we found out we were pregnant with TJ, I was like, let me think. I got to go to her anyway. That's the only person I really trust. And she did great with me. She gets my personality, and she got her own business. So let me go support her. And I know she's going to make sure that I'm going to have a good pregnancy and birth. And it was also at a time, I think, during COVID, where spouses couldn't be in the rooms with the person while they were laboring. And I didn't want anything to happen to me or the baby, or I wasn't going to have a good advocate, because Travis will advocate for me.
Yes. And does.
So I needed that space. I was very nervous about it, but I trusted you and your team to really guide me through that process. And so we did it. TJ came very, 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 very quickly. I was laboring all day. I was very adamant about you delivering the baby. I know you were supposed to go out of town, and I was like, well, I'll wait for you to come back. And you were like, no, but I got other people in place. And I said, right, so you're going to deliver my baby. And she ended up, I think, coming back. I think I was talking to Dawn at one point because Dawn wanted to be there. But was Dawn on vacation? I think so. I forgot. Were you on? Yeah, she was on vacation. And I just remember that whole day. It was like 5 a.m. I was laboring. And I called my mom. I told my mother, hey, I think this is starting. In fact, I know it's starting. In my experience though, when I labor like 5 a.m, by 5 p.m. that night, the baby's here. So my mom was in Miami. My parents, are in Miami. And I'm like, that's a 10-hour trip. But I really want my mama to be here. And I want Christine to be here. So I'm walking, trying to speed up the birth. I'm like, why is this dude coming? So my mom, for real, I was like freaking out. And Travis, I think you called Travis. It was about 7 or 8 o'clock that night and the baby hadn't come. The labor hadn't progressed like I thought it should. I think we was doing a contraction every hour.
But at some point, Mama came.
Yeah, she came about
and put her hands on you.
8 o'clock that night, because they sped here from Miami. And she prayed this prayer. And she said, TJ, now that's enough. It's enough. Your mama is tired. It's time to come on out.
I'm going to tell the rest.
Go ahead.
The baby came without us.
You're not supposed to tell everybody.
Well, your mama prayed the baby out. He came out.
She did.
So I'm running through the door. Y'all calling me. I'm on the phone. The baby's already here. I'm like, oh my God, I'm en route 5 minutes away.
Yeah, you missed them by 5 minutes.
And you're sitting there with we're going to show the clip of that too. There in the pool with this baby.
You got that clip?
I do.
Wow. Okay, I done made the clips.
And I came in the door fussing.
You did?
I did.
Were you hurt?
I wasn't hurt, but I wanted to be there.
Well, you was there in spirit. You were there in spirit. Yeah, but my mama did pray the baby out.
She prayed the baby out.
Because I wasn't in active labor. And when
you were not.
I was not, because she prayed that prayer. She said, come on out. All I know, within 10 minutes. Yeah, it was about 10 minutes. Then the contractions were at 5 minutes, and it was going to 4 minutes, and it was like 1 minute.
So within an hour after the prayer,
the baby was
TJ was here.
So you need to take my mom on the road with you.
So who adjusted you? I know I need both of y'all.
I had doctors in my practice when I was on maternity leave who were taking care of me. So it was Dr. Danielle Jones, different doctors around the area. I know Marlene. I don't know if you know Marlene. Dr. Marlene in Alpharetta. So whoever I can get their hands on me, that's who I trust. You know, I'm big on that.
Okay. So is chiropractic care affordable, and does insurance cover any of it?
Insurance does cover chiropractic care if that certain provider is in network with those insurance companies.
Got it.
So in my office, we're in network with everyone except for Kaiser, because you know how Kaiser is.
Yeah, that's the HMO.
And Medicaid.
Beautiful.
But everybody else we accept.
Lovely.
Got it.
I think that's important for people to know.
Yeah, because they work hard. They pay for the insurance. So I'm like, let's use it.
Snellville.
What about it?
That's where the people have to go.
They have to. They want to see me. We're located, if anybody knows, we're located on 124 in Webb Gin House Road. We're in the Sprouts Plaza where the DSW and the Kirklands is. So that's where we are. We're there every day except for Sunday.
Okay, and what's the website?
100%chiropractic.com. And you can click on locations and hit Georgia, and you'll see my beautiful face.
Awesome. Well, thank you for being here.
Thanks you for having me. We didn't cut up too bad.
We know how to act right when we have to.
Yeah, we have to. Yep.
Well, thank you for tuning in to the Birth Exchange. We are here with Dr. Twila, the best chiropractor in Georgia. Okay?
I appreciate that. And with the best midwife in the whole entire universe.
Oh, God.
You are.
Stop.
You are.
Like, comment, share, and follow and subscribe. And we'll see y'all on the next episode. Toodles.